What's up, guys? Today I want to make a quick video regarding the approach to an arterial line using just a 20 gauge angiocath. The specific catheter that we're going to use today is a BD angiocath 20 gauge with the FEP polymer. This is a different approach that uses similar motions that you would in obtaining an IV, and is different than the arrow catheter. I'm hoping to make a better video once I have an appropriate mannequin, but just wanted to get my thoughts out there. Some of the key things after approaching the artery and getting pulsatile flow, it requires 3 quick movements that consist of dropping your angle ever so slightly, rotating the bevel 180 degrees, and we'll go over why that's important in a second, and then also advancing the catheter ever so slightly so that you are able to simply get the Teflon portion or the plastic portion of the catheter into the vessel. And you can see how the plastic portion is about 1 to 2 millimeters further back than the entry of the needle. And we don't want to just simply have the needle enter the vessel and obtain pulsatile flow, but not have our catheter in the vessel itself, and thus causing the catheter to hit against the arterial wall, which causes a lot of pain, as well as will not allow you to successfully advance the catheter into the vessel. And I wanted to go over this really quickly, but before starting the procedure, it's important to just kind of test to make sure that the catheter is able to twist off nicely. And then after you're able to puncture, rotate 180 degrees, advance 1 or 2 more millimeters, you can simply twist off the catheter and it should advance nicely. It's important to rotate your bevel for this simple fact that it helps you to prevent you from not backwalling into the vessel. As you can see, when I approach a piece of paper, even with my bevel up, I'm able to pierce through the paper. However, if I have my bevel down and I try to pierce through the paper, I'm unable to pierce it as easily. And that's all the thoughts that I wanted to share right now. Like I said, I hope to make a better video soon. Please comment, or if you have any comments or suggestions and any tips. Thank you so much. Last thing that I wanted to add really quickly is it's important to do those 3 quick steps before the blood completely fills the chamber. After blood fills the chamber and starts to exit the posterior portion of the chamber, you'll no longer have pulsatile flow and be able to know that you're remaining in the vessel. So these movements need to be accomplished quickly, and it's important before they fill the back end of the chamber. This can often take lots of practice and dozens and dozens of repetitions, so try not to get discouraged easily and keep practicing.